You know a condition is bad when it was once described in the early days as more painful than walking on eyeballs. So during the historical early days, gout was a disease that predominantly affected the rich. It was described as a disease of kings. Gout is a form of arthritis which is caused predominantly by diets that are high in red meat and in excess alcohol. You can see why it affected the rich during the early historical days, because the affluent people during those times had diets that were plentiful in loads of red meats and also alcohol. Hi, it's Dr. Derek here. Let's talk about gout. So most cases of gout affect the big toe, and the pain that we get from gout is caused by all the inflammation due to a buildup of uric acid and uric acid crystals. And these will build up and form within the joint spaces. An example being the joint spaces of the big toe. Now we've talked about some of the risk factors, so things like excessive red meat and excessive alcohol intake can all cause gout, including certain medications. But in addition to this, certain medical conditions can lead to gout, because certain conditions can affect the body's ability to get rid of the excess uric acid. So an example of this is kidney disease, which is one of the things that can actually reduce the body's ability to get rid of excess uric acid. So the reason why red meats in particular, the reason why they increase the risk of gout is that our red meats are high in a compound known as purines. Now, purines are things that increase the amount of uric acid that's produced in the body, and as we've talked about before, the uric acid is what actually causes and leads to the pain from gout. So how do we go about actually treating gout? So we have an acute flare-up of gout. The mainstay is to really reduce how much inflammation that you're having in the joint, because this inflammation is what causes all that pain and that significant pain. So we can think about anti-inflammatory drugs as the mainstay for an acute flare-up of gout. An example of these kind of medications is one called colchicine. So that's anti-inflammatory, and that has a significant impact on the amount of pain you have with gout. And other examples of our anti-inflammatory medications include naproxen or ibuprofen. So the point of these medications is to reduce the inflammation and move you to a place where the pain goes away and you're more stable. So how do we diagnose gout? Well, gout is formally diagnosed after the acute attack, and after that initial attack goes away and you are stable. So the way in which we diagnose gout at this stage, when things are stable and there's no pain, is by blood tests. So the blood test will look for things such as your uric acid levels and also check on your kidney function. As well as checking for these levels and your uric acid levels, the blood tests are really good because it can determine how effective any long-term treatment is and any particular dose changes that need to be made according to the levels of uric acid that you have in your blood. So after a gout has been confirmed with your blood test, we then move on to our more long-term treatment. Now, when doctors say long-term treatment, patients tend to think straight away medications. But what I want to tell you today as a GP is that whatever you do, so the changes that you can make to your lifestyle will make so much more of an impact than anything I can prescribe to you. So as we've discussed, there's a lot of lifestyle factors with gout, such as excessive red meat consumption and also excessive alcohol intake. So if you're able to make certain lifestyle changes, improve your diet, reduce your alcohol intake, that will make a significant impact on your risk of gout and the attacks of gout. So I really want to labor this point about how important lifestyle changes are. In addition to lifestyle changes, we also have certain medications that can be prescribed to reduce any future attacks of gout. An example of a medication is one known as allopurinol. The way allopurinol works is that it reduces the amount of uric acid that is made within the cells in the body. So in today's video, we've talked about gout, we've talked through some of the symptoms that you may get, some of the risk factors, and more importantly, how you can manage this, so some of the changes you can make to your lifestyle. As always, if you found today's video helpful, please leave a like and subscribe to our channel. Make sure to share this video with any friends and family that you feel benefit from it. And until the next time, I'll see you soon.